able to make decisions on priorities and how budgets and policies are implemented. And we'll have, and how we're advancing the priorities. And then we'll also review these budget policies for you, and Terry will do that. And then we'll go on to discuss what types of issues are coming up before this council at this time, and then we'll go into another work session. Terry?
Okay, with that, I just want to review a little bit of what we did, I guess it was 2 weeks ago. We went through the budget process. We talked about the principles and some roles that each of the parties would have, council's roles, managers, citizen roles, a little bit on public participation, and then finally we talked more in depth about the economic overview and kind of how we got to where we're at. With that, I have the presentation. You have a copy of that in front of you. I also have included in there from the budget document the policies as stated in the document. So if we need to refer to them, we have them. The PowerPoint that we're going through, a lot of it was from last year's budget presentation, just kind of to reiterate the policies, touch upon the changes that we made, and then there'll be a few administrative changes that we're suggesting. Some of it's wordsmithing, some of it is we've just, edited it and just made it sound better or read better, I guess I should say. There we go. Thank you. So moving forward to 12, I just wanted to highlight kind of what's going on in the nation here, but what most of the municipalities are going through, and a couple different tactics or stages, if you will, of how we're kind of getting this, trying to bring the finances back in order, and then moving forward to have some sustainability. Right now, a lot of people are bridging what we'll call from the crisis, if you will. It says right up there, this is a page from GFOA best practices. These was a crisis. Our revenues dropped to 20, 30 million in over a couple years. So what we're doing is we're looking at all the budgets. We're meeting quarterly. In fact, we're doing that this week, and we're scrutinizing the budgets to the actuals and then asking questions about the variances. We are also monitoring the revenues and adjusting those as necessary in hopes of doing some good forecasting for next year. And then the trending analysis, we've actually shortened the term. We used to do 5-year forecasts. We're still doing it, but the trend's going back. We're not looking so much as 5-year averages anymore, but what's really happened in the last 12 months. You'll see that when we bring forward the sales tax estimate, because there was such a change in the percentage increase for so long, and now we're going a little more short-term because it's somewhat flat, which is better than down, but again, we're looking at it short-term. And then moving forward, everyone's trying to, what it says here is to reform, kind of, if you think in terms of, a little bit of recovery, holding in line for a while. Although service levels are continuing to grow for us, it's at a very gradual pace. We're not seeing the double-digit inflation or paces that we had in the last decade. The departments are managing to the bottom line, so we went through budget cuts, and they're working within a base budget. And anything new or increases they have, they're trying to manage within that budget they have. They're challenged to think outside the box and be more effective and efficient with their dollars and resources. Moving forward, we're going to try and transform into more resiliency here, pick up the pieces and see where we can do more with less, I guess. You could say diversify revenues. We've completed a couple cost studies. We're looking for co-op agreements. We're looking at, again, the 5-year plans, both CIP and operating. And tonight, in conjunction with that, we're also going to look at the fiscal policies that we have, and perhaps if any of those need to be changed or tweaked a bit to recognize the fiscal constraints we're under. Again, this is repetitive. I'll go somewhat fast through it unless you have specific questions, but it was exactly from last year's presentation on the policies. We're going to talk about the what, why, and when. The City of Goodyear has 6 categories of policies that we follow, and with that, a number of them, all I think I demonstrated last year, are in compliance with the national, it's the NCSLB, National Council on State and Local Budgeting, and our policies, like I said, are in compliance with those. Oops. Thank you. What are financial policies? I won't read the slide, but they are parameters in which we work to keep, the city fiscally sound. And then why do we have them? Again, for sound financial management, I want to stress here the incorporation of a long-term perspective. And then when are they important, or when do we use them? We consider this to be ongoing, and again, tonight is when we're going to do the second one here, review with the current budget cycle. Also, like I said, going to do a couple text changes. I'm hoping to come up in red. The first one is operating budget. Again, there's a number of items that are within this category. I'm not going to read them all. I just want to bring to your attention that we talked about this last year. During the economic downturn, we became out of compliance with the cash balance, which states that we should be using the cash balance for one-time expenditures only. We've had to use that cash balance to bridge the structural deficit, and so that one is out of balance. We are doing measures to bring that into balance.
Quick question on the construction sales tax. Being used for one-time or capital expenditures, where will that show up on the policies?
There is one on CIP, and then this is also covers that.
But, well, I know it's not operating, but sometimes people look at our general fund revenues and they see sales tax in there, and they make some assumptions that it's actually, part of the operating budget. So I just want to make sure that we actually spell that out on when it comes to the construction sales tax, because I know there's been some misnomers out there that they've been totaled in with numbers that are misled to be operating revenues, and they're not, by policy, they're not supposed to be operating revenues. So will that show up on the capital side? Will that spell that out? I guess is my question.
I'm looking to see where it's at in here. Yes, this is what it's talking about, is the one-time revenue. Even though it doesn't state, the full policies are in front of you.
If you could probably put a note in there, I think it would be helpful, in the construction, because I know the construction is one of those areas that we really kind of strive on, is to be using for one time and not ongoing. Now, I know there would be time when things get rough that you may have to dip, but the policy would be to be at 100% for one time. So if you could just mention that in there, because again, I believe there are some people out there that have been picking some of those numbers up that think they're operating in their capital revenues. So.
And we do list it in the schedule as capital
I know.
revenue, and here it just states a cash balance.
Okay. But if you could make that motion, put that in there, I would appreciate that.
Under CIP section, perhaps, or
Or maybe you can refer both to
We'll find a
operating.
place-
We'll find a
place
place
for
for it. I don't want to dwell on, but if you can find a place where that's highlighted.
Yeah, this cash balance, could you go into detail on that a little more?
the cash balance.
Where does that revenue come from?
Excuse me, Terry, please speak into the mic. The people in the back cannot hear.
The cash balances includes the contingency of the rainy day fund. It would include carryover from the prior year. Right. It's more than that, Frank. And so it's carryover from the prior year, and then any unexpended funds of revenues exceeding expenditures
Where do those show up in our balance sheet?
on fund balance.
They're on fund balance in last year's. At the end of fiscal year, we had we had a fund balance of X dollars that was listed in. Okay. and
Yeah,
that's what it-
approximately. It's running. Of course, it includes the $16 million for the rainy day fund, and then I think in the budget last year, after all the uses were budgeted, it was a little over $1 million.
A little over $1 million.
Right. So together, 17.5,
Okay.
something like that.
And then that's put in with the rainy day fund?
Together, they're about 17,
They're not
18
kept separate.
million.
They're kept in the same,
It's all kept in the general fund.
but they're accounted for separately.
Yes, they are. I mean, we have the 16.3
Yeah.
segregated from the excess.
Okay.
Yeah.
And that's one of the policies here that
Okay.
we'll get into in a minute, where the rainy day fund, if you will, is set aside in the reserve. Okay, so with that, I just wanted to bring to attention again that one cash balance is out of compliance, mainly due to the downturn in revenues. The other ones are in compliance. If you have any questions as I'm going through these, again, please feel free to ask. The second one here refers to the general fund and the 4 months appropriation. The other, where you see utilities in red, that is a change, again, a text change, just to add that in front of the enterprise funds. And then this year we were able to fund the reserves. So I wanted to point that out too, that that is in compliance. There is a change here. We actually cited the last one. It was a bit outdated because the city's reached a population of 30,000 years ago. And so the last bullet here, if you will, or the last sub-policy is right out of the league's book for the definition of what we have to do for the HERF. We have to maintain a certain level from the general fund to support those street operations. Moving on to debt management. Again, we're in compliance with the debt.
Wait, back up.
Back up.
You talked about the street maintenance funds. We've been deferring street maintenance for the last several years, and we recently had a presentation from Public Works that showed us sort of in arrears for doing street maintenance based on a capital asset model. How can you say we're in compliance here when they're showing us in a deficiency mode as far as maintaining the streets of the city?
This is the calculation for financial requirement contribution from the general fund. It's very small. It's based on, I want to say from it's the average expenditures for any 4 years between 1982 and 86. So our commitment, I want to say, is about $50,000.
Okay, so this is not reality. This is mandated. This is not reality.
Right. It doesn't include the highway user fund funding that comes in to support street maintenance, which
And it
is
doesn't
a
tell
lot
us
more.
at what level we have to maintain the streets. That's our separate policies that we review each budget operating year, and that's one of the ones I will mention later about the ones that we will be considering with you this year.
Okay, thank you.
Okay, moving ahead to debt management. Talk a little bit about the last bullet here. As you know, we were able to reduce that rate. I believe it's $1.42 this year. So we are in compliance with that $1.60 or lower. Again, more of the debt management here. Current bond ratings were just recently upgraded to AA- and AA2. We are issuing all new debt for the utility enterprises out of revenue bonds. And the last one, we did make a change in that. Last time we met last spring during the budget policy and increased that to 10% for 3 years average instead of 5.
Let me go back to that one slide, please, for a second. So just for clarification on the enterprise fund, then after this budget year, all water, sewer bonds will be paid by revenues collected by the water, sewer, and sanitation fees, okay?
Yeah, the goal is to have them self-sufficient with the 12 budget.
Okay, second question on that general fund bond annual debt payment shall not exceed 10%, 3 years average. Does that include the PIC bond for the stadium debt service as well?
It
does?
And
Okay.
that's
All right, so that's in there as well, and we're still in compliance with that?
right. The average revenue was about $60 million for the last 3 years. So again, average revenue, and then the PIC payment right now is at $6 million.
Okay, so we're just there then, just
Just
about.
there, 6.7 to 6.1. Budget amendment policies. Again, we went through this last spring. We brought the policies to the council for first quarter. Last time, I was going to say in October, for period ending September. But probably come back in March with period or second quarter amendments. Again, there is a red line in here. In order to comply with state law, we have to, the shifts between appropriations must be approved by the council. What we've done in the past is we have done that during the budget process. Now we're bringing them back with you. So this is to remain in compliance with state law and change the term from mayor to council. In looking at and reviewing these again, a couple text changes here. The community relations, we wanted to just point out that that is a program funding calculation for this, the increase, and then again delete the word budget from there and just put it in annual appropriation. These are things that are for the programs, the CAP office, food bank, senior center, a lot of the nonprofit payments. Okay, just a quick review of the revenue policies. A couple of the changes we made from last year where we extended the user fees and the fee studies to go, instead of doing it annually, every 3 to 5 years.
Let me just throw that, let's back up for 1 second on that one. I know last year we had them updating it was, 9 or 10 years for some reason. That wasn't done. I don't know if I'm still convinced 3 to 5. I know you don't want to do them every year, but is that going to create a problem, 3 to 5, if there's any spikes? Say, for example, coming up, if inflation actually takes off and you wait too long, lately it's been kind of low, is the 3 to 5 years going to create a problem for us? I'm just wondering if it's too long, I guess is what I'm...
We don't want to find ourselves in the position that Liberty Water was in, for example.
I know, that's...
I think that we need to look at quickly each year whether or not there's something worthy of more in-depth analysis. If there is, however, that probably wouldn't occur until the next year because we'd have to budget the study on that. But I think it's something that we have to be sensitive to in an inflationary economy.
All right, yeah, I just would hope that we just kind of keep that in mind because of that issue. Again, we don't want to be in the shape that Liberty was in where they wait too long and to do that. Okay.
And Joe, another thing is that in doing the fee studies for a couple of these areas, we actually, within the study, bought the software to do it in-house. And so we can do that pretty much annually or every other year as necessary to get it somewhat in the ballpark.
Okay, yeah, I'd feel more comfortable with that than spreading it out because, again, the stuff that Liberty took, wouldn't want to be in that kind of position.
For capital budgeting, the most recent change, which we just updated the dollar amount for the capital appropriations amendment to 75, again to comply with city procurement code. In this chart, I just want to outline, I know we're getting into the budget season, we're reviewing the policies here. There may be some reasoning behind adjusting the policies or changing them, and here's where we just want to look at, for accountability, if a policy is regarding a large dollar amount, your debt, your investments, you probably want to be a little more rigid on that. Conversely, on the other side with capital budgeting and operations, maybe that's where you allow some flexibility to allow for the economy and some of the tight times that we're having right now that could be short-term in nature. Okay, so with this, what I did was I went back to these policies, such as the operating debt management and capital budgeting. I just wanted to point out some of the things that we've been successful at or been allowed to do because we've been following the policies. We adopted them, and they're an overlay to our budget process. So for a number of years prior to my being here, we were able to support the one-time purchases with the use of one-time expenditures. Currently, we are able to, within all the budgets, do the maintenance, reoccurring maintenance on things. The construction tax was dedicated or designated to the one-time support for fiscal years 5 to 11. I think in that time frame we've spent in excess of $50-60 million on capital projects. So we indeed, by following the policy, were able to do some large projects.
And personally, I think that's one of our the city's greatest policies because without that, when the construction sales tax dropped from, 22 to what's in our budget now? About 3. If we were using any or large portions of that for operating, we'd be in serious trouble. So
that's exactly what happened to Buckeye.
Yeah, and that's why, again, I can't stress enough that for one time that to me is a great policy to adhere to.
Moving ahead to the debt management, by following the policies that are outlined here for the debt management, setting up some of the equations for coverage and revenue proportion to debt payment. We have been able to move the debt payments to the utility funds which will be self-sustaining in 12. It allowed for us to bond for adamant and provide some redundancy in water, also improve the compliance out at the treatment plant. And within all of this, we were able to maintain and even, in fact, for the general obligation bonds, get an upgrade for the bond rating.
We haven't done anything with capital funds for the Adamant project yet, have we?
For which budget?
Yeah, for this year.
Adamant?
Yeah.
It's it will be a carryover
Carryover
project.
from last year. We don't have, there'll be no additional monies needed to finish that off?
Not to finish what's already started, but we have several wells that are in planning stages.
That's what I mean.
Yeah. There
So
will be
that's-
additional funds that are necessary for those.
Okay, so that'll be coming up in the,
Yes.
this year. budget.
I suspect so, yes.
Okay.
So with that, we've undertaken a cost allocation plan and a user fee study to help diversify our revenues and ensure we're covering costs of select programs that are user-driven. We also continue to seek new revenue opportunities. A couple examples of that are Litchfield Park Agreement, IDA with grant funding for the economic development expenses. Moving ahead to the capital plan, we do prepare a fully funded 5-year plan, so there are resources to back all the projects that do make it into the 5-year plan. Again, we've been able to carry out council priorities such as major street and intersection improvements, a couple of recent public safety projects, various traffic signals throughout the community. The other part of the capital improvement plan, we've been able to do water and sewer line and some public amenities. Again, the policy states that we're incorporating the operating budget into the capital plan, and as you can see in recent years, the capital plan has declined, and part of that is due to the fact that we don't have ongoing funding for the operations.
Okay, right now I'll talk about future policy discussions that we'll have with the City Council. Next month, we have a workshop planned to discuss revenues, and this is a follow-up from the November work session when we presented a forecast in the dashboard that we'll be using. In addition, we'll be discussing such things as billboards and the types of money that are available from the use of them, and the council will be considering an ordinance or a contract with a billboard company to implement that. And on the expenditure side, we have a review of existing programs and services which we're undertaking right now. As Terry mentioned, we're meeting with each department, reviewing each program expenditure, looking at where are there savings that can be carried forward next year. And there will be some savings as a result of personnel turnover, for example, and vacancies that exist that can be applied to the fiscal year 12 budget. How much they'll be right now, we don't know, but we're beginning that process. Secondly, we have the mobile fire EMS services. As you know, the contract is up this July 1st, and they want to either renegotiate with us or have us develop a different delivery system for the services. So we're examining that, and we will have several options to review with you over the next few months. And one of those options will be renew the contract with them. They will obviously want additional monies in order to do that. As you know from the last report I gave you, we're averaging one fire call a month down there, and that's it. Another option would be that we would do what we used to do, which is a full-time fire department down there for men and or women, and that's about a $1.3 million expenditure for the city. And then another option will be putting a 2-man truck down there for emergency medical services. And then with the fire, if they have a fire, because Maricopa is presently in the mutual aid system, because of our helping them get in there, they would have to come over to help our 2 people who were down there. So that's probably the second most expensive one that we'll probably be looking at carefully with you to look at. So, thirdly, there's the replacement maintenance funds. This is one thing you mentioned, Gary, the roads and the highways. As I recall, the work session indicated that we're about $1.5 million short each year in the maintenance of streets. So we're looking at, okay, what level do we want the streets to be at? Because right now the streets are still at a very good level. They're at 82, as I recall, on the scale up to 100. We always shoot at keeping them at 75. So we're at 82 right now. So do we want that to be kept at 82? Or do we want to pick some different number? Or do we want to pick a higher number? All of those obviously relate into how much money will you spend on street maintenance.
John, does that also include replacement, the vehicle replacement fund we talked about? Did we spend all that money last time?
No, we did not. 400 roughly?
Year to date?
Yeah.
Right.
So we have several hundred thousands that we'll be carrying forward.
Okay.
And it's other replacement funds also. I mean, ITS, we have some significant replacements that we need to work with. Our telephone system, as you know, we're doing this year, and items like this. So all of these things will be discussed under the replacement and maintenance funds. And then compensation and health care, we're just finishing a survey of all of the cities in our region that we compare ourselves to. And so we'll be able to tell you exactly where we stand by major position in relation to the other cities, and whether or not we're well below the average or whether or not we're above. I don't think any of them are above. Some of them are right on, but there's also some that are significantly below the average.
John?
Yes.
I'm sorry. Could you go back to the mobile fire EMS services? Does our contract with the sheriff expire in July also, or is that?
Oh, that's an ongoing.
Or is that? So this is just EMS
Yes.
and fire services versus police and public, the other.
That is correct.
Okay,
We don't anticipate any problem with maintaining the sheriff at the present level. We will obviously have to check in with him, but as I recall, it's an ongoing contract, so it rolls over.
And John, can I follow up on that? Are we also going to look at other opportunities rather than Maricopa? Like, isn't Gila Bend out there? I don't know if they have their own fire, or is there anyone else out there that we could look at it as well?
We can look at Gila Bend. They do have their own fire. They're 32 miles from Mobile.
Oh, okay.
So they're a lot further than Maricopa is. But yes, we're looking at all of those options. So.
Okay.
Real quick, John, on compensation, on the 2% employer-employee Social Security, is that taking effect now?
Yes, January 1st.
January 1st. So that means,
Social Security went down 2%, pensions went up about 1%.
but we got a point, though.
Yes.
You got a point there, so it's saving you a point on, as from an,
Roughly, yeah.
okay, all right.
Yes. And then the last item is reserves. As you know, we've discussed a little bit with the council. We'll have much more in-depth discussions about what level of reserves do we need. The rainy day fund we have is 4 months, or 33.33%. There has been some, we've talked with our rating agencies. They have all said that going down to 2 months would even be acceptable if we do it in a planned fashion. What concerns the rating agencies, if they see a city precipitously drop and go from a third down to 20%. So we're looking at the fund, the 4 months, and trying to determine, is it something that can be used, a portion of it, for example, to help leverage or transition over something that we're trying to get through right now, and we'll have recommendations and discussions with you about that also. Those are some of the major things that we have coming up in the near future. And as you know, the calendar that we have before you shows all of these workshops and the different sessions that we'll be reviewing with you, the different subjects. And the work session under February for the retreat is going to be an interesting one. We have, I think, 4 hours that afternoon. We'll be working with you on many different things. We'll be using the dashboard so we can do some projections, and that'll be kind of exciting. Then that'll be followed with a work session on the second quarter financial reports, and then the staff will be holding a public meeting on the proposed budget so that we can report back to you what the public has said about the budgets. And then that will move into March, when we do a revenue update, and then the work session on compensation and benefits, and the work session on the capital improvement program. And then in April, we'll have the balanced budget proposal and a work session on the additional follow-up from that proposal. And in May, we've reserved the meeting for a follow-up on the balanced budget proposal, and we have a tentative budget adoption at the regular meeting in May. Then in June, we have a work session reserved for follow-up from the tentative budget adoption, and the final budget adoption is at the regular meeting in June. Terry or I'd be happy to answer any other questions that you might have.
On this side? Jerry?
Yeah, but Frank had someone else. Come back, I need some.
Okay. Dick? Go ahead.
I need more information on the reform, the recovery plan. Could you give me more detail on that? Can you hear me? I'm sorry. Can you give me more detail on the recovery plan in reform? Long-term therapies, recovery plan in, explain what you mean by recovery plan, I guess what I'm asking.
Well, in our terms, there's a number of things that are going on. First and foremost, I think, is the shifting of the debt to the utilities, so that the general fund is a little more self-sustaining, as well as the utility. And then the other thing that we're looking at, it's been real important, is the vacancy list and freezing those positions. It's kind of
I'm sorry.
the vacancy list of the positions
Okay.
has been another short-term strategy for the recovery. The other thing that we've done the last couple years in a row, we actually do some forecasting with the community development folks, and we've really drilled down on the development-related activity and honed in on the projection for housing moving forward. And so that number went from community development-related revenue, I'm going to say double digits for sure, 15 million, and now we're estimating 4 for this year. So that's another type of recovery method, if you will, or tactic is a better word, that we put in place to just ensure that we understand the revenues and then the trending of what we're seeing today.
And is that moving toward the sales tax, possibly lowering the sales tax in the future?
Well, the whole picture would be to balance out the general fund. We actually look at every single revenue, what comprises that, what the activities are, what they're doing today, if they're up or down. And so it's, we look at that as a whole picture. So if a number of other revenues were increasing, you could potentially hold one of them flat or offset it. Mm-hmm. As we're seeing it now, first projections coming through, the revenues are estimated about $1 million up. It doesn't include hits or increases in funding from the state, which are two of the major components.
What are you talking about? These are sales tax?
It's actually all general fund revenue.
All general fund.
Mm-hmm. It's like our first draft of the general
So
fund
it's
revenue
showing about $1 million.
estimating.
No,
We're showing about $1 million
$1 million.
up.
Okay.
Right, but I can't stress enough the impact that potentially could be from state shared revenue, that the legislation could take the money. And again, we have some, we're hopeful that we have some potential money coming forward because of the census count.
And it helps. I read somewhere where we are the second fastest growing city. in
We
Arizona now.
issued more permits, building permits. We're the third. Gilbert is the only city that's higher than us. And then I think it was Gilbert. I think we're second. Yes.
Yeah, I thought we were second to Gilbert. Yeah, because I always use that as a.
And as I'll report on tonight under the manager's communications, we're at roughly 7.16% of all housing being built in the metropolitan area is in Goodyear. And that's up from where we used to be historically, is at 4% of the entire market. So from that standpoint, that's another positive sign that Goodyear is starting to recover. So that's it.
Okay, so I forgot what I was going to ask you. Foreclosures, have they leveled off yet at all?
And I'll also report on that under the manager's
Okay, good.
communications.
Great.
And Goodyear is doing very well there. We're down 21% right now from last year. Maricopa County is down 7%, so we're doing a lot better than Maricopa County, but yes, we're down 21% right now.
Just to follow up real quick on Frank, the revenue sharing, any idea when we will actually get those numbers from the state?
March.
March?
Oh,
Yeah, I mean, whether they're
Usually
going
the bulletin comes out in March.
around March, okay. And then I guess one of the discussions we're going to be having also is that street maintenance fund. And I guess when you come back with that, I think it would be helpful. I'm sure you'll have that, but is cost risk. I know we like to shoot 75 at 82, but as that goes down, I assume the risk will go up, which means we'll be more subject to suits and whatever with the road conditions. So if we can see an analogy on where that may be and to
And
make
we
sure
can-
we're not increasing our risk on, you know,
and we can discuss that in depth because as you go down below 75, the further you go down, the price, the cost to bring it back up go up incrementally.
yeah, that's the kind of my feel. So we can get kind of a happy medium maybe in there if we've got the funds to try to, in other words, if we, what's the old saying? Pay me now, pay me later. If we drop too low, it's going to cost us a lot more long term. What's the most efficient way of doing that? The revenue sharing. Oh, also our December sales. We will get those because we're in the state system. What about February?
Well, we should have them by February 20th.
Okay.
They have surprised us a week early, once or
Okay.
twice in the past. We're hopeful that they'll surprise us again, but all I can tell you is by February 20th, we should have them.
Yeah, I'm hoping for some good numbers there because I know our November numbers are at I guess the national numbers are looking a little better in there. So I'm kind of
Yeah.
looking to see what our December numbers
And I'll
are.
report later in the communications. Our November numbers were up 7.79%, which is terrific.
Okay.
And from a budgetary standpoint, we're at 5-point-some-odd% over. So we're about $741,000 in sales taxes over budget right now. So that's going well. And Frank had mentioned the sales tax rates and things. We're looking at various options and how that rate can start being brought down for you all to consider. So.
How much better would you say the city is than other communities around us from a sales tax standpoint?
Oh, I'd say I don't have any numbers I can cite, Dick, but the city of Goodyear is in very solid, very good position, not only from a general sales tax collections, but also from an operating budget, because the city did address things early, did start freezing salaries early, did start eliminating positions early. We're in a far better position. There's cities like Tempe, for example, that are struggling with a $20 million deficit right now. Cities like Phoenix is grappling with, I think the paper said, $80 million deficit.
Mm-hmm.
So the city of Goodyear is in a very strong, healthy position. For
Good to hear. Thank you.
Yes, sir.
John, I have a question, if I may. One thing I've heard a lot of the news is about the cities possibly, not necessarily Goodyear, but like several cities are talking about bankruptcy. If other cities do that, are we high enough up that we're not going to be impacted with our bond rating?
I don't know if it's like the stock, but if things start to fall, they all start falling.
I was reading earlier today on CNN something about municipal bonds are they're going to start re-evaluating them. I don't think that ours are at much risk because we were just re-evaluated this past year and ours went up. So I think our bond ratings are pretty good. If, just for an example, and I'm not suggesting anything like this, if a city like Glendale were to go into financial difficulties, which no one says they're going to, I don't think that would affect the city of Goodyear. So I think we're pretty well protected.
Okay, that was my question. If other cities have financial difficulties, you just mentioned when you said Tempe, that kind of, I was wondering about that. That doesn't necessarily affect our rating. We're rated separate just on ourselves.
Yes, we're rated totally on ourselves. And Tempe, this is one thing, it's just like our structural deficit. Whenever we have a deficit, it's like Tempe, I mean, their 20 million might be like our 3 million. I don't know, they're that much larger. But everyone, the management community, they have to balance the budget, so it will be balanced. How they're going to do that, that's going to be the question.
So you're saying that the experiences that other cities are having would have no bearing at all on our rating?
That's correct.
No, not direct bearing. There was a question I had on the, just thought of it. Oh, it was maintenance money for, I don't know whether this was maintenance or capital, let me think. It had to do with several needs. Here it is, expenditures. Review of existing programs and services. Mobile fire, we went through that. And then replacement maintenance funds, compensation, well, that's not it. Yes, that was, the EMS services, okay. I thought there was something down here on EMR Parks. Did I read that?
Here it is.
I don't think there's anything on parks.
This one,
Yeah, EMR Park,
capital budgeting.
on the capital budgeting.
And that was in reference.
There it is, yeah.
That was in reference to some of the infrastructure that we, as a city, have been able to put in place by following the policies. So we were.
EMR Park meaning,
Estrella Mountain. Oh, that one, okay. That's the park, community park up in Estrella. It's not the county park. We're
It's not
still
the county
working on
park.
that, no.
okay, you're still working on
Yeah.
that. So this is the park, our park by the high school.
Yes,
And that's the only other park that's ours, isn't it?
I believe so, yes.
And now we're in charge of all the utilities for those at this point.
That's correct, yes.
Because that switched over.
We're switching over, we're in the process of switching over. But we are going to be responsible totally for the watering of those parks, and the schools are going to be responsible for the watering of the school grounds.
That's all potable water.
No, it's reclaimed water and potable water. I think it's a mixture. I think we're converting it to potable, yes. It will be, excuse me, it will be potable from the city once we take it over, because the agreements with Newland are that they have the reclaimed waters into their system to fill the lakes.
And do their landscaping.
Yes.
Okay. Was that the original plan?
The
Seems like
original
that's-
plan, I'm sorry, Frank, I can't really speak to that.
Yeah.
I'll have to check and let you know.
Yeah, because that's, that one bothers me a little bit, that we're using potable water when there's reclaimed water available to do parks and, even if they are city.
We will let you know, Frank.
Yeah, because there's combination of both city and I guess the parks that are under the jurisdiction of the homeowner association or Newland, I don't know which.
Yeah.
Anyway, I think we need to look into that.
I will do that.
Okay,
Thank you.
appreciate it.
Any other questions? Okay, thank you.
Thank you.
Much.
Next, we have medical marijuana. Joe will, I think, will come up.
He's coming out.
Okay. And we'll brief you on the changes that we're recommending be made to that. And DSHS today, and Joe can talk about that also, introduce some additional information about what they're doing for the medical marijuana.
Sure. Light up yet?
Well, hopefully we've addressed some of the concerns the council has, so the ordinance won't go back up in smoke again tonight, as the newspaper
Oh, God.
reported. That was their headline, that wasn't mine. The council directed us to get back together and talk about potential revisions to the ordinance that we presented at the January 10th meeting. And I was directed that before we get into the specific revisions, that it might be beneficial for the council to have an overview of the act. And Susan Rogers from the city attorney's office is going to entertain you with that first, and then we'll move on to the specifics.
Before you go any further, let me make a clarification of last meeting where I said that I had voted for medical marijuana. The devil must have made me say that. I did not vote for medical marijuana. So I hope I can clear the record straight.
Yep.
Thank
Neither
you
did
very
I, because I didn't want to write this ordinance. It's all yours.
Thank you. I'm not going to give a complete overview because you've heard most of this, but I'm going to supplement what was talked about last week or last session.
What is your name? I'm sorry.
Susan Rogers.
Susan? Okay.
Susan is the assistant city attorney.
Okay.
When the medical marijuana passed, we're the 15th state to pass medical marijuana, and there's a huge movement behind that. And incorporated in the statutes of the proposition is a requirement that the State Department of Health Services be the regulator of this. They're required to draft rules within 120 days of the passage of this proposition, of this going into law. So what you're going to do is you're going to read the statutes, you're going to read the rules together, and that's going to regulate the dispensaries. So far, the Department of Health Services has issued an informal list of rules, and there's been about 1,300 comments made on those. There's going to be a new issuance of rules on January 31st, and those should be more formal rules. Still an opportunity to comment, and lots of people are commenting. The biggest question everybody seemed to have here was about the security for the nonprofit medical marijuana dispensaries. Now, for clarification, there is a myriad of requirements that the rules are putting in place for the application process to open a dispensary. Under the statutes, you can have 1 per 10 pharmacies. That's how the Department of Health is going to determine that. That's the total number of dispensaries allowed in the state. What they're going to do is they're going to try to have the dispensaries evenly distributed throughout the state so they're not stuck in one place. And remember, when you have a dispensary, you have less likelihood of a qualifying patient being allowed to cultivate marijuana, because if there's a dispensary within 25 miles of where the patient resides, they're not allowed to cultivate. If there is not, they're given additional opportunities to cultivate. So the rules provide all sorts of security measures. In addition to the lengthy application process, they have requirements regarding in the security for video cameras, the electronic monitoring. There's video cameras regarding the entrance and the exits, all areas adjacent to the building, each point of sale location, each grow operation. It has to adjust to the low light. They also have cameras for every person that's coming into the building. There's exterior lighting. There's detection for unauthorized intrusion. There's additional security equipment to prevent that. There's a failure notification system that provides an audible and visual notification. These are all requirements. There's also remote viewing and live recording. So what's going to happen is the Department of Health Services is going to inspect these facilities and actually oversee them by remote access. And there's also panic buttons. In the cultivation site, which is may or may not be with the dispensary, they are equipped with locks. They have limited access. And in fact, in both places, all marijuana is limited to the personnel with the access card. And those people are dispensary agents. They've all gone through the process. They've had fingerprints taken. They don't have excluded felonies. Where marijuana is to be grown, it's supposed to be kept in an enclosed, locked facility. If it's either going to be in a room with 4 walls and a roof, or it's going to be an area surrounded by 4 solid 12-foot walls with metal and wire mesh. So the rules are very much supplementing the statutes and putting all sorts of requirements and security measures in. In addition to that, the dispensaries are supposed to have policies and procedures regarding security. They're supposed to not allow consumption of marijuana on the premises, and that's also required by statute.
I'm sorry.
You cannot consume marijuana on the premises, and provides for identification and restricting access. And then you've got your inspection by these facilities. So there's the Department of Health Services trying to put a lot of checks and balances into the rules to ensure that these are safe facilities for the communities and for the people that are going in there. Go ahead.
Is this program designed for individuals, or can corporations also extend themselves to, say, a conglomerate, for example, comes in into your city, and they want to maybe got 3 locations? Can they do that, or is it subject to an individual?
Well, it's a corporation can do this, but their partners are going to be checked. You have to be an Arizona company, so the primary principal agents have to be in Arizona, and the cultivation has to occur in Arizona. It's not, they have to cultivate 70% of their marijuana, and it has to occur in-state. So it's not going to be someone coming from out-state that's going to bring, all their marijuana to our state. So there still is a check, even if it's more of a corporate entity. There's still going to be a check.
One more question. With all the requirements that they have for establishing a unit, what would you say the monetary value of that is, expenditures for the equipment and the requirements that the ordinance have?
I'm sorry, I have no
I think,
idea.
frankly, I think it's going to be a hindrance to a lot of people, individuals, because they're going to be rather expensive, I'm almost sure.
The alarm system process and the video camera, yeah, it is, plus the inventory control, it is going to be expensive.
Well, it sounds to me that some of the information you're sharing we didn't have at
Correct.
the prior, and so that really answers a lot of the concerns on the security side. It sounds like they really were at least thinking ahead, and so I appreciate, at least so far, what you've been telling us. Sounds good.
Now, these rules are not passed yet, but it's very unlikely that this information will change because it's not going to go less secure. It's most likely going to go more secure.
Well, that would be the concern, if it goes less, and then we don't follow up with having the same, I guess kind of the same as they're stating. But if you don't think, well, I still think it wouldn't hurt for us to just kind of coincide our rules with what you're presenting now.
Councilmember Osborne, a lot of that has been incorporated into.
Yes,
into the new
I noticed that. I think the only thing I did notice was the a question of whether or not they should have on-site, like security guards. I don't know if that's necessarily necessary. I thought I read that in here somewhere.
I believe
It's in the proposed revision. It's not part of the state's rules.
it is not. There is a medical director on-site requirement, but not a security.
I mean, with everything else that you're stating, I don't know if that's necessarily needed. But go ahead. I'm sorry.
Oh, no. That was the majority, I think, of the issues that were raised last week. There was some talk about concerns about children. Both the state statute and the rules require 500 feet from any private or public school that's then existing. So if you build one later, that you do that at your risk. But I think our city ordinance has a different requirement, a further requirement.
For which,
Yeah, I was also concerned, like businesses that cater to children, whether it's skateboards or, I was not just the schools and whatever. I was more concerned of businesses that just cater to children, where they could pop up as well. So
Swimming pools or anything.
and the way we addressed that is we restricted it to the industrial districts in the revised ordinance instead of allowing it in commercial.
Now, a question I still have is, if we voted not to have a dispensary of any kind in Goodyear, then that opens the door to someone growing their own marijuana, right?
Yes.
And within legal rights. But wouldn't they have to come to the city for a license of some type, some kind of permit? Or can the city set up a policy of no license or no, we just won't issue a license in the city?
There's a couple answers to that. One is I don't know that we can actually, the statute didn't give us authority to opt out of having a dispensary here if that's where the Department of Health Services was going to put it. So that limits us in one respect. Also, this is not for the designated caregiver or the qualifying patient. Both of those people could grow potentially. They are not functioning as a business under this statute. They are. So I don't believe that there would be necessarily a licensing requirement for them.
Okay, but if they were growing it for their own use and it was prescribed by their doctor, then they can grow it in their own yard, right?
That's correct.
I mean, it has to be secured,
That's correct.
but they can grow it in their own yard.
12 plants.
And a caregiver could grow 60, right?
The designated caregiver could be a caregiver for up to 5 people, 12 plants per person, so 60 plants total, not counting the plants for themselves if they also were a qualifying patient.
So what I'm hearing is if we don't come up with somewhere to put them within 25 miles, it'll be more of a nightmare for the police because now they're going to have to check all the homes where the stuff's being grown. So, it's where I'm hearing it. It's up to having a place secure if it happens to be in the city, so they have one location versus the potential many people growing them in their homes. So, that's what we got to be careful about. If we don't put the ordinance or whatever in place, then it opens up to people growing it in their homes, and which I think will become, I'm sure the police chief can speak to that, but I would assume it'd be more of a problem under that scenario.
In addition, and they're going to address this, there's also a requirement in our ordinance that's not in the rules and not in the statutes, and that's there be a distance requirement for the designated caregivers growing operation. And that's something that's very important that's not currently there, that you would be authorizing as a distance requirement.
I have a question. What is the limit for one of the dispensaries? How much of the product can they have on hand, and in what form? Is there a requirement on what form? Because I know in California they've been putting it in all different forms. There's even a soda pop that it's coming out with. And
They can put it in food forms, and that's addressed in the rules, and it can be transported to make food items. There is no requirement that I've seen so far on the limit of what they can store on site. I just know how much they have to produce out of their own dispensary, which is 70%, quite a bit of marijuana, depending on what your clientele is.
so we wouldn't know exactly if one of these places was broken into. We wouldn't know exactly. I guess they would. Are they required to keep records on how much they have on site?
Yes.
So we would know how much was stolen or how much was missing.
There's a fairly intensive and extensive inventory requirement, so yes, they should know, and they will know the exact nature and type of that marijuana and where it came from and so on and so forth.
Will the state have inspectors like we do with alcohol, tobacco and alcohol?
Yes, the state does have inspectors. My understanding from listening to them is that they plan to inspect mostly by remote viewing as opposed to in person. But on initial opening of the dispensary, there is an in-person inspection. But
Why did they do that when they've got, with alcohol and tobacco, that's a department that has a person on site. I mean, they bring a person on site for that. There are people.
Sure.
I mean, it shouldn't be on our police department. That's what I'm concerned about.
Well, our police department won't be inspecting the facility. They'll have to respond to calls for service. But the nice thing is that the remote viewing will allow capturing of still photographs of someone that's in there. It will allow them to go into the facility at any time. So it does give them that access. They're not limited to, they're not foreclosed from being able to investigate in person. It's just, I imagine they're not going to do it as often as they.
And I think it's primarily a budget issue, Frank. DSHS is under very severe budget restraints, and the state, of course, is also. And so the live person coming out to do an inspection just isn't in the budget for the state.
Our legislature pays no attention to that. They just pass these laws and doing it.
Well, this one was passed by the voters, but yeah.
Yeah, I know. But someone had to initiate
Yes.
it. And hours of operation to be somewhat like a pharmacy. The dispensary. I mean, you have that.
Hours of operation are addressed in our ordinance, which
Yeah.
is,
Okay. Let's wait till you do that.
I think it's 8 to 7 now. It's intended to kind of keep it during daylight hours, which hopefully will make it easier to monitor for the police.
I have a question. The police are monitoring it, and this is what I kind of thought was kind of interesting. I know in Los Angeles, the DEA has actually gone and shut down some pharmacies that weren't abiding by statute because it's still illegal under federal law, although we made it legal by our voters. So I guess, is the DEA, do they get a copy of these regulations, or are we setting up business? I don't know how that's actually, that interplay between the federal and the state is going to happen here.
The DEA has taken a position that they are not going to take any action on these unless there's a major trafficking incident going on, an interstate type action. So, no, they're not that involved unless there's a problem. The police aren't really monitoring; they're responding if there's an issue.
Okay.
One last question. So within the dispensaries, you have added in there that there shall have at least one security guard who's properly licensed. Now, in other dispensaries, I mean, how many employees typically are there on site? I mean, who came up with adding the security guard? Is this it? Has this been within other jurisdictions?
Yeah, I found it in the ordinances of at least one other jurisdiction, and it was an attempt to respond to the council's concern about whether security was adequate. Granted, it is a fairly strict requirement, but the intent was that only those people that would have business at the dispensary, basically a card-carrying patient or dispensary agent or qualified caregiver, would be allowed to go into the facility. Now, some facilities operate where they sell other products besides medical marijuana, and they sometimes set them up where you have a facility within a facility. So this could be a little potentially problematic for that type of an operation. But if it's solely for medical marijuana, then the theory being that the only people that need to be in there are the ones that are qualified.
Do we regulate any other business by making them have a security guard when they're open?
To the best of my knowledge, we do not.
So this is essentially a restraint of trade or an impediment to whatever operation this is going to be.
Well, it's being proposed not for that purpose. It's being proposed for the purpose of making sure that the business operates in a safe and secure manner. It is handling a product that, even though considered lawful by the state of Arizona, is still subject to potential abuse and creating problems.
If the agents who are running this business are licensed and bonded by the state, why are we adding an extra level of requirement or impediment to them? What is a security guard going to do for them that, you know, a trained licensed manager would not do? I mean, do we have a security guard at alcohol at bars? Sometimes you need them to be bouncers, but do we require one?
No, we do not require one. And let me just emphasize that this was an attempt to respond to the security concerns that the council had. And if the council feels that they're more than what they had anticipated or desired, then that's certainly within the council's right to modify it.
I personally think this is onerous as far as a business goes, and I would not want to see that put in our ordinance.
The follow-up on that question, though, is could you defend it, I guess? Because I guess one of the key issues that we always asked, or at least I asked in the last meeting with the attorney, is we've got to be careful on how strict the ordinance is, because they could always come back and sue us and throw it out being too onerous, as Councilmember Gelser mentioned. Could you defend that part within there and think we would be able to stand up?
I think the analysis is that this business is a little bit different than bars. I think what Susan would tell you is that based on the experiences in other states and the way the banking industry views this type of business and the federal law, that they're a cash business. They're not processing credit cards, is my understanding. So the concern you have is you have a business that, one, has a product that's in demand for certain consumers, plus you have a business that has a lot of cash on hand, which may or may not be using the banking industry. The banking industry may be a little reluctant to be handling these transactions because of federal law. So if you were to take a position that that's going to create secondary effects, i.e. higher burdens on law enforcement, I think you could argue that your police powers to promote the public health, safety, and welfare would support this additional requirement to have on-site security just to combat the secondary effects that are particularly attached to this type of industry. So that would be the thought process. Has it been tested? I'm not aware of this particular provision being tested in court, but that would be the argument you would make. So as a policy body, a court would give your judgment some discretion in making a decision.
The DEA did say that a lot of these businesses do have ATMs inside because the banks won't allow you these businesses to use them because it's a violation of federal law. So it works exactly right. There is excessive cash going in and out of these facilities.
And I would mention that, I mean, the purpose of the work session is to kind of get all this out on the table and decide which additional requirements the council is interested in including or not including. So I appreciate all the comments, and if we've swung the pendulum too far in the other direction, then that's can be corrected.
I'm sorry. I just wanted to say I'm not advocating for that position. Just I think there's arguments you can make to support it if that was council's direction.
Well, and I was going to say, I'm not so sure about the security guard. Does other states, I know we're patterned after Colorado, is that a common addition to the Colorado ordinances, or
I
Do we-
don't think Colorado ordinances address it.
require it? Because when you started mentioning cash, I started thinking more so rather than we're trying to protect the product, maybe the employees there as well.
Well, that's not our position, though. That's their business position. And banks, if they want to have their own security guards, they have them. Jewelry stores want to have their own security guards, they have them. I mean, really, a man with a badge sitting in there or with a gun, he's a deterrent. But, you know, they're going to be trained as to what the proper procedure is if 5 guys come in and say, all right, let us in, we're taking it, you know. I think it goes one step beyond our regulating authority. I think that needs to be in their hands, and I think that we've addressed so many issues, and actually the state put many items in there already. I do not feel comfortable with telling them they have to have a security guard. I don't.
Jill, when you were taking testimony from potential applicants, what was their response to having a security guard, or was that question not brought up?
That question hasn't come up, and I haven't gotten a response from any of the industry on the current ordinance.
Can we add that if we find there is a problem? I don't think we're going to get a lot of these in Goodyear, to be honest with you. I don't think we're going to get one.
Well, yeah.
Yeah, one.
One,
I mean,
yeah.
we have 14 to 16 drugstores, and if you get 1 per 10.
Well, it's
so
not
we're
per
gonna get
city,
one.
right? Isn't it per the whole state? So they trying to spread them out. But if there's 100,000 in the state, then you can get 10,000 or whatever.
Yeah,
But
I think the department's position is they want to see them spread out, but I don't know that the department is going to ensure that they're separated from one another. I mean, if they want to make sure that there's at least one available to qualified patients, they want to promote that.
But what I'm asking, if we
What we're
find,
trying to promote or in guard against is overconcentration.
oh yeah, like a clustering. My question is, if we find there is one dispensary or just one specific business that is causing a problem, what are our remedies with regard to one that is, you know, kind of a rogue one that out there that is causing the problem? Or you might have 2 others that are doing just fine and following the law.
Come to Jesus discussion.
We could probably at least attempt to address it under the security plan requirement and the operational plan requirement. That
We could say no to
that
security
their
guards
security-
now, but
that
then,
their security is inadequate if there's proven problems.
so if there's proven problems, rather than saying we're going to make them all have this burden. Because I kind of agree with Joanne on that, you know, it's like, but if there is one that's a problem, what is our way to either pull the license if there's one problem, or is that when DEA gets involved? I mean, is that where if we have one that it seems to be a problem, we have lots of problems coming out of that?
It depends on the problem.
Or can
about
we
who would
add
get involved.
additional security, I guess?
The Department of Health Services is the one that has the licensing authority, so they would be the one probably to address it first.
Okay, because I know, like, what I think Gary brought a good point with, like, there's other drugs, oxycodone, OxyContin, and those are at Walgreens, and those are abused highly as well, and they don't have security.
That's a simple change to certainly entertain. If you'd like for me to run through the changes quickly, would that be helpful?
Yeah, please do.
Before we get to the meeting, thank you, Susan, for enlightening everyone with respect to the act. At the January 10th council meeting, we felt that there was about 6 items that were brought up. The security, obviously, which we've just touched on already. Potential adverse impacts on adjoining commercial uses, especially those catering to children. The need for nondescript signage. The separation requirement for adult businesses. Compliance with the one entrance requirement and fire code requirements. And the total number of locations overall. Those seem to be the concerns that were identified. So, taking those into consideration, we've tried to redraft the ordinance to address them as the best we can. Drawing from ordinances that are either been adopted or are in the process of adoption of the other cities, particularly in the valley. The original proposal was to allow dispensaries to sell or cultivate marijuana on site by right in the C2, I1, or I2 districts subject to certain separation and development standards. And the off-site cultivation location would be allowed only in I-1 and I-2 districts, also subject to certain separation and development standards. We've revised the ordinance to limit dispensary and cultivation locations to only the I-1 and I-2 districts, again, with separation and development standards. We deleted the reference to off-site cultivation since dispensaries are now limited to the industrial area, so it's less likely to have a dispensary in a commercial area in an off-site cultivation location. We added a definition of medical marijuana infusion because that was not particularly adequately addressed, and after seeing how the state intended to address it, we added it to a definition and restricted it to dispensary and cultivation locations. The separation requirement in the I-1 and I-2 districts was increased from 2,000 feet to 5,280. The mile separation is what the City of Phoenix is adopted, and the City of Glendale also is currently considering that for adoption. All the other separation requirements are the same, except that we added a separation from adult businesses of 1,000 feet. We added to the development standards for dispensaries that they provide us emergency contact information so that we would have 24-hour contact available. Unrestricted access for law enforcement as a requirement for checking for compliance. A secure storage area strong enough to deter theft, and then use of the secure storage area to store all marijuana when not open for business to also deter theft. Proper disposal of remnants and waste, that they not put it in the outside trash container. A prohibition on emissions, which sounds funny, but it seems to be popular. Only one secure entrance and alarmed exits. With respect to the fire code question, it is possible to have a retail outlet of a certain size that has only one exit. There are limits to the size, but the limits that we had proposed in the ordinance actually could fall within that. Depending on the occupant load, the size of the facility would shrink, but it is possible to meet both a one entrance requirement and the fire code requirements. But we also provided so that if it's an exit only, that it be alarmed and available for exiting only.
Wait, Joe?
Yes.
Just for us simple people, you can have one entrance exit that is for the public, and you can have a second emergency exit that's alarmed
For fire code requirements.
for the fire code requirements.
Yes.
Thank you, fine.
We added a requirement for the video surveillance system, which Susan has mentioned is actually in the state rules already, but we're piggybacking that. Requiring posting of no loitering signs at the dispensaries, making sure there's adequate exterior security lighting, posting with security guard at the entrance to restrict access to only those with registration cards, and then requiring a security plan that we would look at locally as well as what is submitted to the state.
Well, that item is posting of a security guard is the one that's up
Right.
for discussion.
Yeah, I didn't have time to get it off the slide before it came up.
No magic?
With respect to the cultivation locations, the size of the facility was originally limited to 3,000 square feet. It was proposed to be increased to 4,000 after we reviewed it with the Planning and Zoning Commission. And based on additional information we'd received and the fact that we were limiting the facilities to industrial areas, we've increased it to 5,000 square feet. So that's in the revised ordinance. The original proposal contained standards similar to those for the dispensaries, but we've added, and we retained those. We added a requirement for the entire facility to be secure, also a requirement for secure storage within the facility and for it to be used, and added access being limited to the principal officers, board members, registered dispensary agents, which is also something that's in the state rules. As you know, before we had proposed using the C2 in industrial zoning districts. Under the original proposal, there was about 3,800 acres available. The revised potential location map limits it to industrial with a mile separation. That results in about 2,400 acres available for potential use. And it's been estimated that there are 2 potential sites in existing buildings and 15 potential sites for a total of 17 sites based on existing zoning and the proposed separation standards.
Question. Concerning Mogul, there is no drugstores in that immediate vicinity. If Maricopa, for example, had a dispensary, could they avail themselves to that dispensary?
They would be within 25 miles, yes.
Okay.
This is a brief summary of the original proposal where we had the 2,000-foot requirement and a number of locations. We had 46 potential locations under that scenario. Under the revised proposal of I-1, I-2, in a mile separation, that reduced it to 2 potential built locations, 15 vacant locations, and 17 overall. The other 2 lines give you a sense of what it would be like if we modified the separation requirement or modified the zoning districts. So that pretty much sums up the changes that were made, and we'll accept any other comments, suggestions, or changes that council may wish.
Yeah. Nothing along your lines, but Susan, let's assume that a corporation has 3 or 4 facilities that their headquarters for. Do each one of those facilities have to have a license?
Yes.
Okay. All right. Thank you. Good.
Anything else?
Thank you.
I'm hearing
As long as we pull the security guard stipulation out.
I think I'm hearing a consensus on that, am I not? The security guard? All right.
Just when you make your motion tonight, just say motion to approve, deleting the requirement for the security guard. And then that way we won't have to go through an amendment process.
Okay. Is that it for everybody?
I have a quick question.
Quick question? Okay, go ahead.
When you were talking about the disposal, they're not to dispose it in normal waste facilities. What enforcement power do we have? Are we going to change our city code for some of that? Or if they don't post that, is it a criminal offense? Is it a civil offense? What do we do?
The way the code, this is structured to be a zoning ordinance violation, which could be prosecuted either criminally or civilly.
Okay, so if they just dumped it on the back, we have a recourse.
If it came to our attention that that was going on, and we could pursue it through a zoning violation.
Okay. I'm okay.
Do you have something, Freddie?
Well, I just have a comment, and that is that I know we set up these standards and we set up all these rules. That was done with alcohol, and then it loosened up. Had to be cash. Now it's everything, credit cards, everything. This thing can get out of hand. I just can't believe we're talking about it, and I'm still opposed to it. So I'll just go on record as saying I'm opposed to any of it. I'll be voting against it when it comes up.
Anything else? Information. Council members report. We're going to have an opportunity for this again. Do you have anything now, or wait? Manager?
No.
Before we do, we're going to need some time to set up before we go upstairs, or how about a 5 minute?
2 minutes, 5 minutes.
Have a 5 minute break?
That's fine.
Okay, 5 minute break. We'll get back at 5 up. Okay? Meeting adjourned.